And this morning, we have released a notice, and in the afternoon, we held a coordination meeting at the city government level. Many leaders of the city have coordinated the efforts between different departments. And now we are ready to answer the questions. And today we have with us the Deputy Director of the Nanjing Health Commission, Madam Yang, and the Director of Nanjing Health Authority. First, let's give the floor to Yang Dasu, Deputy Head of Nanjing Health Commission. Distinguished guests, ladies and gentlemen, good afternoon, good evening. And now I would like to report to you about the epidemic. Since July the 20th, Nanjing has reported 23 local cases and 14 asymptomatic cases. As for the whereabouts of the confirmed cases and asymptomatic cases and suspected cases, we have already reported to the public, and 2 of them are in Lishui district and 2 are in Jiangning district. 29 of those cases, they work in airports. 3 are loading staff, 2 are loading staff, and the remaining 3 are people with close contact. With respect to the classification of risk levels according to the COVID-19 measures formulated by the city and province, we have adjusted a number of villages, for example, Chenxiang and Paijiakou, into medium risk areas. And starting from June the 23rd, and that is today, and we have made further arrangement and adjustment to the risk levels, and this includes a number of areas. And I have a map at hand, so we have selected one region and designated as a high-risk area, and its borders Yuchonglu to the east, and Daliangang River to the south, East Lake Chijia Village to the west, and also Qihang Avenue to the north. We have selected this area and designated it as a high-risk area in order to minimize the impact to people's life and work. And within the high-risk area, we put in place scientific management. For medium-risk areas, we put in place unified disinfection. And for key group of people, we will continue with the health monitoring. And for high-risk areas, we would engage with a thorough inspection. If we identify a confirmed case, we will immediately transfer him or her to the hospital, and all the factory plants and companies will be temporarily suspended. Public places such as supermarkets will also be temporarily suspended. And because of the different situations in different localities, and we will adopt different measures, and this is designed as such to cut the transmission and eradicate the source of the epidemic. And we also ask for the understanding of the public for any inconveniences that we cause because of the COVID-19 measures. And if you have any difficulties, please let us know. And third, with respect to the airport area, the provincial team has made it very clear that those who have traveled in and out of the Nanjing airport between July the 10th and 20th will be subject to strict quarantine. And in principle, those people, they have to be quarantined for 14 days. And they are also advised to take a home quarantine. And for those with travel history to the airport, they have to have their health conditions monitored. A unified quarantine is able to cut the transmission of the disease, and we can also accelerate the pace of NAT campaign. At present, most of the positive cases are identified in the local international airport. So if you found out that your health code is now in yellow color, please make a call to your local community and cooperate with some of the management measures that we are taking. So may I now give the floor to Deputy District Mayor, and for her to give you an update about the life support that we have been providing. Dear friends from the media, good evening. Jiangning District has completed the first round of NAT. We found 22 confirmed cases and 13 asymptomatic cases. This morning, we initiated a second round of NAT at local sub-district level, and we will update the public about the result of this NAT. And right now, we have 1 high-risk area and 19 medium-risk areas. At those streets, we have set up 14 blockades. We also arranged police forces and also volunteers and also veteran party members from community level to hold those blockades. And in the morning, we also dispatched some experienced cadres from the grassroots level to add to the team of staff. Since the measures were taken on the 20th, we have continuously improved the measures according to realities, and we also dispatched 73 medical staff from a number of hospitals just to ensure the needs of medical support at people's homes. Considering the mental status of the people in quarantine, we have formulated a 24-hour service hotline. In the meantime, from the number 2 hospital, we have dispatched 8 psychological doctors. The service hotline is 5270 and 1760. We will provide mental support around the clock. In the meantime, we have stepped up control over the high-risk area. Community level cadres are working closely together with each other to engage in health monitoring. We are also providing food and daily necessities to all the people under quarantine. Our voluntary staff, they are delivering those goods and supplies to people's doorsteps. For some of the customized needs of the people under quarantine, they can register their needs and get in contact with our volunteers. And today we have just designated a high-risk area. We are improving the control measures and closing some of the public places in the area. We embrace scientific measures of control. Apart from those necessary service providers such as convenience stores and clinic centers, we are closing some major supermarkets and other public places. We also put in place enclosed management for nursery homes. In addition to that, for all those people with a travel history at the local airport, we have set up a NAT center, and that is located in Nongyuan Avenue at number 109. And please also spread the message to others. Now the press release is open for questions, and before you raise the question, please also identify yourself. I'm with Nanjing Daily. According to what standards you have designated the high-risk area? Let me answer your question. In order to put on ground scientific management and control measures and minimize the impact to the general public, we look at different counties, communities, and cities and districts. And we also look at the number of cases reported. Following the developments of the pandemic, we would categorize the different areas into different levels of risk. We are working closely together with relevant personnel in conducting epidemiological surveys, and we hope that the general public can provide authentic information. And also, if you identify symptoms around you, you are kindly requested to report the situation to health authorities. And if you found people with similar travel history to high-risk areas, you are also kindly reminded to report the situation to health authorities. And if you show some symptoms, for example, dry cough, sore throat, and high fever, you are requested to resort to a hospital or clinic center nearby. If you are showing symptoms such as high temperature, you are requested to disinfect all the objects that you have touched or used. The general public is also encouraged to maintain a positive attitude, refrain from panicking and worrying. For ordinary citizens, we need to maintain a healthy lifestyle, wash your hands often, ensure sufficient ventilation, pay attention to personal hygiene, and also pay attention to food safety and security, and avoid going into high-risk areas. I'm with FM 93.4, a radio station. So do the people in Nanjing have to go to designated centers for NAT? Well, let me answer your question. In order to minimize the risk of cross-infections, we have set up NAT centers at different districts. In the morning, we have released the information to the public. The public is not advised to take public transportations to the NAT centers, and we do not encourage people to travel into a different district for the NAT. If there are some difficulties for you to take the NAT, you can get in contact with your community authority, and the community will make some specific arrangement for your nucleic acid test. Next question, please. I'm with People's Daily. As the Deputy District Mayor has mentioned that a huge quantity of tests have been delivered. And yesterday, the number was 2.04 million. Why is there such a difference between these two figures? Well, let me answer your question. And today, a total of 1.23 million people have been tested, and yesterday 2.04 million people were tested. So there is such a difference between these two figures, and this is because we are in a process of refining the way of statistics and statistical analysis. I can tell you with great certainty that this 1.23 million figure is correct. In Jiangling district, we have a total population of more than 2 million. We also have 200,000 university students, but they have been released from school and they are on vacation. So I can tell you that we have basically completed the massive NAT. All right, this is the end of the Q&A session, and according to the joint mechanism and consensus reached, we will continue following the instructions, and we have every confidence to wage a people's war against the epidemic, and we have every confidence that with the leadership of the government and with the cooperation and support from the general public, we will definitely claim a victory against COVID-19. And this is the end of today's release. Thank you very much.